Hi everyone, it's Tremia, and I'm finally back from the chemotherapy, feeling a little bit better. Of course, I'd like to feel a lot better, but I guess I'll get there eventually. Um, One day there will be a cure for lupus, and we won't have to go through all this uh, medication that's not made for us, but the only thing that helps. One thing I've noticed is that, I've tried to drop my medications in the past and try to drop the chemotherapy, and then I did, and the lupus flare was so much worse than the side effects of chemotherapy. I mean, it's hard to believe, but it's the truth. So the treatment outweighs the disease. So I'll keep on moving forward. Today I'm going to talk about fibromyalgia and also pain associated with lupus. Fibromyalgia is usually a secondary diagnosis to lupus. I know every lupus patient that I've spoken to, they also have the diagnosis of fibromyalgia. In fibromyalgia, you have pain in tender points. I forget how many there is over your body, but your doctor will put pressure on those points, and they bring me down to my knees whenever she does that, and she says she's barely touching me, but it hurts. I mean, it's just excruciating, and then it continues to hurt for like 20 minutes for the pain to eventually subside and go away. So the fibromyalgia, the pain is in the muscles and in your ligaments and in your tendons. And also, it will continue to get worse if your sleep is, deprived. And usually you can't get good sleep because the fibromyalgia puts you in so much pain. So it's just a catch-22. And, you need to be speaking with your doctor, and you guys need to work on, how you're going to get you some good sleep and how you're going to get the pain under control. It'll probably be like sleeping medications and pain medications. I know my doctor, with all my medications that I'm on, I can't do any herbal remedies or anything like that. So, we have our game plan worked out, and it does fairly well. Um, I get some good sleep. The pain in lupus is different. The pain is from the arthritis that is associated with lupus, so it's joint pain. You'll get, joint pain, your joints will swell, maybe get red and hot, but that's the pain. That's how you tell the difference between, what's acting up and what's flaring. If it's the muscles and tendons, it's your fibromyalgia. If it's a joint, it's the arthritis and it's the lupus. And it's the arthritis associated with lupus is not the disfiguring arthritis. That is rheumatoid arthritis that's disfiguring. And there's a lot of women that I've seen at the infusion center, that they have RA right along with the lupus, and you can tell, their knuckles and their fingers are starting to turn, bend in certain ways, and, it's just really sad. And, that they're going through both lupus and RA, and, I consider myself blessed because I'm just dealing with lupus and the arthritis that goes along with that. And, my doctor, she manages it with, with pain medications, and at her op to keep, they're really good at how they handle pain medications. You have to sign a waiver and that, and we have to tell them exactly what pharmacy we're going to use to purchase our pain medications from. We can only use one pharmacy. If not, we have to advise them of the change. Also, they do random drug testing on us, and to make sure that just our pain medications are in our system. So they keep it under control. The only place I've had a problem with my pain medications is every time I'm checked into a hospital. They get the pain management team out there, and they try to mess around with your pain meds, and it's horrible. It's a horrible experience. And then even worse than that, the nurses think they know more than what the doctors have ordered. And the last hospital stay, we had to call in the head of nursing, because I guess the nurses, they're not used to dealing with patients with chronic illness. Usually a patient's in there and out. They don't realize that, you've been on these drugs long term, and the side effects and of them taking you off or skipping a dose. It's not good, and they can't do that. They're not, and actually they're not allowed to. They're the nurse. They should go by the doctor's orders, plain and simple. So whenever you're in the hospital, I recommend that you have a patient advocate there for you that can help you keep everything under control and watch out for your needs, because otherwise it can get ugly, and get ugly quick when somebody else starts messing with your pain medications. Well, I'm going to let you go on that. If you have any questions, please comment me, rate my videos, and subscribe so we can get the message out there. Talk to you later. Bye-bye.